All right. Good morning. Thank you for joining us. This is part of the series Coping with COVID that we're putting together from Advance Iowa, which is part of the Center for Business Growth and Innovation at the University of Northern Iowa. For those of you who are listening to us live, I really do appreciate you taking the time to join us this morning. And throughout our conversation, if you have questions, please feel free to ask them in the Q&A box, and we'll either answer those in the chat if it's a private question, or we will answer it in the course of the conversation. First, I want to start with a little introduction. My name is Amy Dutton. I'm the Regional Director for the Small Business Development Center at the University of Northern Iowa. If you're not familiar, the Small Business Development Center Network helps startups, entrepreneurs, and small businesses with all stages of their business cycle. And right now, that a lot of that work is helping folks as we deal with the uncertainty and the challenges that are being posed by the current pandemic. Today, we're going to talk about something a little different. We're going to talk about stress and kind of that mental health aspect of how do we cope with a situation like we have today, and how we can take care of ourselves and take care of the others around us, whether it's in our organization or our family, as we are going through this. And I have a special guest today. My guest today is Jake Scahefer. Jake is a licensed mental health counselor in the state of Iowa. He received his BA and master's from the University of Northern Iowa, majoring in family services and mental health counseling. He's done extensive work with individuals and families and specializes in anxiety, which we all have a lot of right now, teens, work-related stress, stress management, management training, and faith-based counseling. He's worked in a lot of places across the area: U of I hospitals and clinics, pediatric oncology, Allen Hospital's emergency mental health unit, Grinnell College, and the Woodward Academy. And he's had a private practice here in the Cedar Valley for several years, which is how I know Jake. And he has also served as an adjunct professor at UNI. So Jake, thank you so much for joining us this morning and being here to share your unique viewpoint as both a mental health provider, but also as a small business owner, as we kind of look at what is this stress doing to us and how do we deal with it? What would you want us to know about you and about your practice?
About myself a little bit. You did a pretty good introduction there, straight off the website. So that,
there you go.
That's what we try to put out for everybody that comes across our practice. No, we're family life, married with a couple school-age kids. My wife is actually, from the small business perspective, we came to the Cedar Valley. The big passion of mine and then as well as my wife's and our practice is, we're here for people during uncertain times. So it's always been our philosophy that mental health can be more than mental illness. Different, we work-related stress, transitions, life transitions, family transitions, all those things can provide different impacts on our social, mental, and emotional health. So that's always been our philosophy, is just taking care of people well. We take a very collaborative team approach to it. So I'm very well connected in the Cedar Valley and try to take a collaborative approach. So it's about everybody being healthy and getting better, and not just what we do at our practice. I'm been to the Cedar Valley, obviously, with my 2 degrees. I took a break, came back, tried to stay on when I was at Allen for my internship on the emergency unit. My wife's from Charles City, so we're Cedar Valley people, and finally got the opportunity when we moved back to start practice to stay here. So obviously not generally been committed, but especially right now is the middle of, we're in a pandemic and kind of crisis state, and a lot of uncertainty as we're not sure what's happening medically, financially. There's just a lot of stress academically with her. I know my wife more, she's the business manager here. So she handles so it's family business on both ends. So it impacts us somewhat uniquely. We don't have 2 jobs, but she's at home during the day, and how should we be educating our 7-year-old is in 1st grade, and then coming in and handling the business end of things and the billing. And so, we're under the stress, happen to be mental health for our business, but also, we're kind of in the same circumstance as a lot of people of trying to figure out how all this works. So
yeah, we talked a little bit yesterday to kind of prep for today's calls, and we said that it's we're not only having dis-ease, the word disease, the root of it, dis-ease, due to our businesses and families being affected by something that's out of our control, but we have this extra stress layer of the unknown. This is a completely new kind of disaster that nobody has been through. So we have the normal stresses that come with either a business downturn or something you're trying to figure out. But then we also have no life experience, no world experience to help us draw a map or to draw a plan of what this looks like. So I'm going to start with a little bit of a science lesson, which maybe not everybody's going to love. We're going to take a minute and look at the brain, because I think this is helpful for people to understand that there's actually a biological reason for the way we react. So can you see that right now? Jake, can you see the
Yeah,
brain?
absolutely.
Perfect. So since you're the expert here, why don't you tell us just a little bit about where do we normally function? How's this great organ that we have? What's it normally doing?
Yeah, and we'll spend, a little bit of time. I always like to spend more time, what do we do about it, and not
Right.
How does it work? But context is really, really huge. So what we've learned from a mental health perspective with all of the hard work our neuroscientists are doing, and with the brain imaging we have now, and brain mapping, we understand how certain components work a lot better and how those impact. So from a kind of normal day-to-day stress, are things typically what causes significant stress are things that come up unexpected. From a micro scale, you're driving to work, you're going to get there on time, you get a flat tire.
Right.
Or if you're speeding a little bit, you might get pulled over. That causes stress because it was supposed to be this way, but it's going this way. So from cognitive function and a neurological function, everything, the green part is our prefrontal neural cortex.
Right.
So that's all the us stuff, our emotion, our logic, our creativity, our engineering, and all those components that make us us and unique.
Right.
The perinatal, or the yellow part, is our sensory processing. So how we orient to our circumstances, how things trigger, how we interpret and view things. So my kind of version of that in the great state of Iowa, seeing a tiger hawk tends to be either a really joyous experience, or potentially, if you're an Iowa State fan, a really angering experience. So that's kind of the sensory grounding and association thing. Now the stress center, specifically the amygdala, is regulated in that cerebellum. So in there's a little tiny point called the amygdala, and the stem is the brain stem. So that's basic functioning. So kind of the catchphrase is that's the lizard brain. So
Yeah.
Lizards don't have much of that prefrontal, if any of the prefrontal cortex. Some mammals do. It's more fully developed in humans. But every animal has that cerebellum, and that's what happens is when there's hyper stress or it feels threatening. So I use the physical example. If you're being chased by a bear, the fight, flight, or freeze kicks in. So
I'm going to pull that up because we talked a little bit about that yesterday. So we do have those three responses. So when we go back to that kind of lizard brain, as you said, this is what comes out of it.
Right. And so if it's a physical threat, you run away. If you have something, you fight back. Otherwise, maybe you'll get small and hide for a second, hoping the threat passes until it's safe to come back out.
Right.
So that's what happens in a physical. And once that stress center is activated, it's a survival mechanism. So it naturally starts shutting down areas in that non-essential functioning. So it's kind of that the power goes out, you got a generator, you're not going to turn on all the lights in the house because you're going to try to energy conserve, get through until the energy gets back on.
Right.
So that's kind of a correlative with how the brain works under those circumstances.
So all that us stuff that lives up here in the frontal lobe kind of gets turned off, and we go back down here to emergency power, which takes away all the bells and whistles, all that critical thinking, maybe all of the personality, maybe some of our empathy. That stuff all lives up here, right?
Absolutely. And when it comes to work-related issues under that high circumstance stress, which we're all under right now, this is a highly stressful, uncertain time. It's going to affect everybody to a degree. But executive functioning, decision-making, processing, emotional regulation, those type of things don't function as well under stress as they would under non-stressful life circumstances.
So let's talk a minute about what do these fight, flight, and freeze. We talked about them in a life or death circumstance, but what might it look like if you're a leader in yourself, or what might it look like in an employee or a coworker or someone on your team. If you start seeing them responding in these, they're in that high stress. What might that look like? Do you have any ideas what we might see?
Yeah, absolutely. I think when I'm processing through stress with clients that I have here, what it can look like, and these are the things to watch out for, and that's where I provide the context. There's knowing what's happening. The biggest additional stress on top of already feeling stressed is what I say, I'm not myself and I don't know why. I'm reacting, I can't think straight, I got brain for all this stuff, and I'm not myself, but I can't figure out why I'm not that way. There's nothing super terrible that's happened. So the fight tends to look like, and I say these are atypical to personality. When you're not stressed, when you're not tensed up, when you're not nervous, these things typically don't happen, but under those circumstances, you kind of react this way. So the fight tends to look like increased irritation, agitation, or aggressive behaviors. So even something about, I'm generally not short with people, but man, I just, the proverbial, I can just throat punch about anybody, anywhere right now.
Yeah. So when you see somebody snapping who's not normally, that's
like
not
that
way,
right?
That's an indication of that stress being expressed.
Right, absolutely. That's the fight, because the stress response is to keep you safe. So if you can't handle anymore and you need something to stop, that lizard part of the brain, it's make the threat stop by any means necessary. So you yell at somebody, they tend to stop.
We hope.
Right. The flight kind of turns into atypical withdrawal or isolation. I just want to get away from everything, kind of it can mirror depressive symptoms of, I don't want to get out of bed. I'm not motivated. I don't want to just even function. I don't even want to work out. I don't care about watching the stuff I like.
Yeah.
So
from a work standpoint, it might be that the work starts piling up. If you're seeing that person in person, it might be obvious. If you're doing this remote thing that some of us are doing, it might be not replying to emails. It might just be
right. You could have highly productive, engaged employees that maybe, that's an indicator to look, maybe is this someone, how are they doing? Are they feeling just a little overwhelmed right now? Because that's going to be an instinct is to withdraw. And these are all subjective. Usually people have a primary and secondary one. The last one, freeze, which is more people are familiar with fight flight, but the freeze component, the proverbial deer in headlights. You freeze up. What that can look like is brain fog, can't think, losing stuff, I can't keep track of things, emotional numbness. I'm not just feeling like I'm not enjoying things like I used to, or I don't feel like myself. The executive function, so decision making.
So nothing. You just can't come to a decision about something because you just
can't figure it out. The best one I heard, there was a lady under high stress. She's like, I'm standing in the grocery store with 2 boxes of cereal. I can't decide which one to put in the cart, but part of me knew it was just cereal. It's not that big a deal, but it's like I could not physically figure out which one to put in.
I love that, because that does talk a little bit about that consciously, we may know it's just cereal, or it doesn't matter, or I can move forward. But when we get into these times of stress, or we are maybe starting to veer into depression or some of these other things, what your conscious mind wants and what your lizard brain is going to do are completely 2 separate things, right?
Right. And they're not completely disconnected. So you're functional, but not functional. And that's the orienting part, that knowing what's happening is usually that difficult part, because we tend to minimize and avoid it. So, I mean, it's something to really pay attention to, because it's there for a reason. And the more we avoid it, the more that cerebellum, that amygdala, if we're ignoring a threat, it's going to get louder. So again, from a safety, if we're being chased by a bear, like, yeah, there's a bear on the horizon, I should probably kind of move, but at some point it gets closer, that part just kicks in. It's like, you're done. I'm taking over and you need to flee because this is super dangerous. So if it's mental and emotional stress, you can know it and you can still function, but it's much, much easier to minimize, because we can rationalize that, well, you know, I just shouldn't feel this way, or I should just be able to do it, or things like that.
So when we recognize as leaders or parents or friends or, you know, even children of aging parents these days, when we feel that we're getting into one of those response modes, you know, what are some of the tips? I'm going to bring up a document that you shared with me, but let's just talk through some of these ideas that you have for things that we can be doing to maybe minimize or address some of the things that we're experiencing here. Get the other document here. There we go. So let's talk through some of these, Jake.
Yeah, absolutely. So the biggest thing to remember when it's there is a physiological component. I trust people are smart. People find the right image. But even if you Google brain image, anxiety brain, uh, and pull up the imaging, you can find like PET scan anxiety brain. It'll show some imagery of how a brain can shut down under extreme stress. So it's physical, it's physiological first. So you treat a physical thing with physically first. So a really good resource tool is one, you want to keep it simple. Because your brain's not thinking clearly, you don't want to add more to it and make something overly complicated. So it feels counterintuitive, but having some simple stress techniques that you can engage in relatively easily for a short amount of time can really, it might not make it all go away, but it can take it from a 10 to a 7. Or it can keep it from lasting for a long time to lasting for shorter periods of time. So a few simple ones, some deep breathing provides that oxygen flow. Again, that's good for brain processing anyway. So 30 seconds to 2 minutes of just some slow 4 count in, out. And doing that again for even 30, 60 seconds can help slow that stress response down. So you can start using your whole brain again. Some people so if you're kind of a tactile person, muscle tensing and relaxing. So you intentionally kind of go up and go down and just flex and relax parts of the brain. There's some really good apps out there. The main one I introduced is the Calm app.
Mm-hmm.
It's free. It's got some good mindfulness process. It's got, nature, sound, auditory stuff that's calming and centering. Those are all good tools because that starts to tap into the brain that you're in healthy control. You're gaining control. You're not ignoring stuff and you're starting to cope with it.
Right. I love this grounding exercise. And that's when you get to that panic, that overwhelmed moment where you really need to hit the pause button and just, okay, I'm letting it get out of control. Here's a way to do that.
Yeah, absolutely. I mean, those are good techniques, a start one. So and they work for, I'll walk people through people that have had anxiety prior to this. They work in extreme levels of panic attack. So when the brain's completely overwhelmed, those techniques work to keep them out of severe panic and anxiety. Mm-hmm. So if they're working at a macro scale under severe conditions, they're definitely going to help under increased generalized stress.
Yeah. So I love, I think this next section, this mental processing is a little more like when you've got a little more bandwidth, maybe.
Right.
To spend the time processing.
Absolutely. That's a great analogy.
Yeah, so this is just kind of trying to get some stuff out of your head so that you can sort out all the stuff that's swirling around. Is that a fair way to say that?
Absolutely.
Yeah. And tell me a little bit about that one true positive statement for every negative. What do you mean by that?
So there's a couple ways to go about it. But what are generally naturally, let's be honest, we tend to have a lot of negative noise in our head, or can. And so being able to dump in some simple techniques of, you can write them down in box, write down in box. I learned this from another counselor, really good technique. You just kind of keep a side notebook or something where you're jotting those thoughts down. You put them can put them in a box of some sort, and you can ignore them or go back to them. And there's some visual action step with that kind of helps that get out of your brain a little bit easier. And then time and place. It's healthy control of acknowledging okay, it's there. but I'm going to put it away. And if I need to go back to it, I'll go back to it.
Right.
You know, I've had, again, people with very intense emotional life experience. Had some people that would box up their negative thoughts, and at the end of the week, they'd have a campfire and they'd throw them in, burn them up, and they were done. And
Yeah,
it really did.
there's some great freedom in letting go of that stuff and getting it out of your head and onto paper. And that can apply to whether you're having personal stress or right now when we're thinking about as a leader or as the head of a business, we've got all these things, you know, some of them are just fears and really you can't act on them. One of the things we talked about yesterday, and I just loved this saying, there are two things that we said I wanted to make sure we brought up was, one is that we're a doing society right now.
Right.
We're a doing society in general. And right now we are being asked to not do. So right now the doing in general as a society is not doing. And that's really hard for us. We are super geared to productivity and how many emails in the inbox and all of those things. But right now the doing is just not doing.
Right, absolutely. And that's very unsettling. And we're in the Midwest, man. We work hard.
Yeah, we've built our reputation on our work ethic, right?
Absolutely, 100%. We put in a long day and then you can take a breath at the end so you can pump up and get back to it tomorrow.
Right. So I think
that is a boundary.
It's important for us to recognize that is a challenge right now and that everybody universally is feeling that challenge. I also wanted to talk a little bit about why as leaders, you know, well, first, let me just take a quick second to remind folks that they're listening to Coping with COVID with the Advance Iowa team, our friend Jake Scahefer from Cedar Valley Counseling Services. And if you have questions, feel free to put them in the Q&A box and we'll get to those. We're kind of getting into the last third of our presentation here. I want to make sure that if you have questions that you do ask those. But as leaders or even parents, you know, we have that feeling like we have to keep the stiff upper lip. We've got to be strong for the team. We've got to hold it all together. Do you have some thoughts about why that might not be the right approach?
Yeah, absolutely. I mean, we need to be fluid with that first part of the brain. The brain stuff where we talk about, we need to be processing this and not shoving down what we're experiencing. Super normal. I mean, it's kind of that, again, we're generally not emotionally processors. So the instinct, like you said, brave upper lip, and we get through and we're stoic. The problem with that, it's there, it stays there, and that's where it can get toxic if you're not fluid. So, and that can look different for different people. You know, it doesn't have to be the same for everybody, but it's really important to be processing what this experience is and not skipping over. You know, that's the problem with the jumping right into it doing. You know, as business people, you know, what happens when you skip steps, when you jump from not having all your resources, not having your data, not having, you know, something as simple as, you know, knowing what your markets are, and you jump in, let's say an ad campaign, you don't know what you're targeting, you don't know what you're marketing to, and you just jump in and do it, you get negative results. And that's the same thing if you're not being mindful of this emotional process and the intensity and weight. You know, social media can be a good thing right now. It can also be very overwhelming and maybe not the best thing to be on.
And media in general. And I think that's something yes, it's important to know what's happening. But one of the other phrases you used yesterday was talking about what's within our realm of healthy control. And so media can provide a lot of fuel to that fire of things that are well outside of our realm of control, much less our realm of healthy control. So define that realm of healthy control, if you would, for leaders who are listening or those of us who might want to try to control everything around us. Right.
A supernatural response. We want to be able to, if it's in our control, if it's we can dictate the outcomes. And the uncertainty of this is that we're not in control of a lot of things right now. Through medically, resource-wise, even, you know, through certain state mandates right now, is we're not making a lot of decisions are being made for us, and that's hard. So being able to orient and take some breaths, what is within your control? What do you want your story to be kind of as the end of this? And we will get through it. We are extremely resilient. This is the first time in our history, not the first time in history, that our country, our society has had to overcome and work through huge crisis and hardship. So also important to remember, because some of the urge, it can feel like the end of the world. This is the end of society. You know, we're at a complete loss. So being mindful of those feelings, and then what can you do? We've got kids at home. We're trying to figure out this homeschool, keep the business going. Back of our head, how do we handle employees? We're processing all this information, and me trying to stay connected with clients and everything. And so school's a bit on the back burner for us. That's not our strength. That's not our resource. That's feeling too overwhelming. So he's learning a few things. His teacher's great, staying connected with us, but we're not doing homeschool, breaking down, having a classroom in the house right now.
So figuring out what's realistic, what's manageable, and maybe cutting yourself a little slack right now.
Right. And so what are some healthy controls we can get underway? And as stuff starts to orient, some, I've heard some from leadership people, I think it's a great idea. Some are going, you go just take a break and have this be a vacation. If you're not being directly impacted by COVID and your responsibility is to stay home and flatten the curve, then stay home, flatten the curve, and go rest, because we're going to need all the people that aren't sick when we get through to the other side. There's going to be a lot of work for us to do to recover economically, our businesses, our people, getting people back to normal, getting people readjusted. So if your period right now is to rest and relax, then please do that. Because if you're overly stressed now, we're going to have too many people recovering that way as our country and our state recovers.
A couple more things I wanted to make sure we mentioned. Yesterday, we talked about specific things leaders can do to help their staff. And one you said that I thought was really great was asking your team members or your employees or the people that you're supporting, what are 2 things that are making it hard for you right now? And if they're within that realm of healthy control, you as a supervisor can maybe change those. So maybe we talked about email flow. Those of us in the helping industry right now are just being overwhelmed with resources and programs and whatever. So maybe it's saying, I need to unplug from my email for 4 hours. I just need a break from it. Or is it maybe there's too many conference calls and we're not doing anything? Do I have to be on all of them? So I loved that idea of a very concrete, what are a couple things you as a leader can do? You also mentioned yesterday talking about all the things that, of course, we know a lot will change, but what won't change. And talk a little bit about, you talked a little bit yesterday about your mission. And I think this is great for leaders to hear. So talk a little bit about that idea of what won't change when we come out on the other side.
Right. And that's something I've had to personally reflect on, is all this information we're juggling. We fully switched to telehealth, but a lot of us had to figure that out. How did that work? Insurance wise, everything. So taking our breath as we're still trying to manage clients and manage everything else, is why do we start the business? What was our mission to start with, and how do we stay true to that as we work through this crisis? And for us, it was, we're going to provide a top quality mental health experience, whether it's people in our office or we connect them to the right resources in the community, that we're going to stand next to people. We're going to be there for them, work as a team, and we're going to help stand with them through whatever life circumstances that they're facing and going through at the time. And hopefully they've got some better resources and feel a little bit better on the other side when they first walk in and connect with our office. So that's what we're going to do. We're going to stay to point. We're working with our counselors, we're working with our staff. We're walking people through switching over to telehealth, which is anxiety provoking too. How do we manage? How do I stay healthy? If the business side of it, if myself and my other counselor that works in our office, if we're not billing, we're not making income. So how do we balance out helping people, but also taking care of ourselves and our employees? And I think the big thing is people are what they can remember is, if you are having to make a hard decision, if you're having to let some people go, if you're having to make those very tough leadership business decisions, how it's being done and for the reasons it's being done, most people are going to walk away and be understanding in those circumstances.
Right.
And if you stay true to point what your mission was, when it gets to the other side, you're at least going to know that you held your ground in something you believed in, because that's been my experience. I'm working with other small business leaders. Nobody started those businesses because they didn't believe in what they were doing, and then they could do some generally good, whether that's a product, whether it's a service, whatever that business is. And so being able to kind of stay true to that. So when a year from now, when we're talking about how we handled COVID, As business leaders, as community members, we have some good points along with the losses that we're going to take. We are going to take some hits. It's going to be hard. But being able to have a story that you walk through to the other side of that and you were able to stick to, it can help in the moment, and it's definitely going to help as we heal.
I love that. So you said that yesterday. What do you want your COVID story to be? So as a leader, what's within your realm of control? What do you want this to look like on the other side? So a couple things I want to just quickly touch on. We're running out of time here, but I want to make sure that people know when the rubber meets the road, if they decide that they need help beyond what their DIY self-care stuff can do, how does somebody seek mental health care or counseling care? What's that process look like? First, I want to say, if it's an emergency, obviously, please call 911. If you are suicidal or someone you know is suicidal, please call the suicide hotline at 1-800-273-8255. So of course, if it's an emergency, respond in kind. But if you're just looking to maybe find a counselor and take an approach to dealing with some of this stress we have, what can folks do?
Yeah, absolutely. And services are really accessible, and feel free to get a hold of us at our practice. Our belief has always been, again, staying true to mission, is if we're not the right fit is huge. You got to feel comfortable with the people you're talking to. So if you contact us, if for any reason we're not going to be the best service for you, and very well connected, know kind of who does what, and so we'll get you to the right places. So even just start, you can email us, pretty safe that way. Contact. There's Google around here. Most people use insurances. Most primarily people, telehealth right now is a service. Luckily, fortunately, a lot of the insurance companies stepped up. We're going to reimburse that. We've got a lot of programs. There's flexibility now. So if an agency, we do happen to have a secured network telehealth system, they've loosened up, and you can do Zoom, you can do FaceTime. Not the standard protocols, won't be forever, but luckily medical community has realized in a crisis we want to get people connected. So a lot of people telehealth. So if you're scared to go out, if you need that's a very viable service. Employee assistance programs, a lot of people have those. So yep. You might be able to tap into human resources right now, or ask your employer, and most offer 3 to 6 free sessions. Yep. And the last thing I'd say right now, people are nervous. I get the stigma in mental health. Nobody wants to be labeled. Nobody wants to feel like they're crazy, because right. That's how people feel. That's the undertone. The reality is, especially right now, I generally tell people that are nervous about it, give it 2 sessions, 2 hours for the rest of your life. If it doesn't help and you don't like it, you never have to go back. But if it does, and it can be a really good resources that helps you feel better and helps you get to a healthier spot in life, I feel like that's a very, very good investment. In the meantime, don't push it right now. An hour, I'm connecting with people. I've got some people calling in. Spending an hour just to unload on somebody who's not your family, not your friends, will stay private. Things are confidential. That can be therapeutic in and of itself.
So absolutely. So Jake, again, thank you so much for making the time today. You're a very, very busy guy. Appreciate it. Great information. So again, those of you who joined us, thank you so much for being part of the conversation. You can find Jake at Cedar Valley Counseling Services.com, and it's Jake Scahefer. And if you want to see the whole series of the Coping with COVID webinars, you can find past archived shows and the upcoming shows at advanceiowa.com. And again, if you want help with your small business, you can reach out to the SBDC at iowasbdc.org. Again, thank you all for joining us. Please take care of yourselves and be well.